had the longest one for this location was probably 2+ hours that we made the trip. I'm always encouraged by that and flattered a bit. Like, we got some interesting things to offer.
YouTube famous.
I'm YouTube famous? I don't know about that.
Sure.
I don't know about that. But here's the thing. What I've realized is whether you go 5 minutes or hours, you're here because you want some information, you want to get something better in your world, am I right? We're going to talk about that. We'll wait like 1 more minute here and we'll get going. So let me ask this question. Let's say your condition magically improved. Where would you go? What would be the dream vacation or what would be somebody?
Anywhere,
right? Okay, that's fair.
Everywhere.
Yeah, everywhere and anywhere. Okay, that's perfect. We'll call that good. All right. Well, for those of you that don't know, I'm Dr. Tomasetti. I am a local guy. Grew up here in the area. Born at Holy Spirit Hospital. Went to school. Came back. That's the short version, right? Been doing this for over 20 years now, and have some information to share with you. And really, my heart today is to show you another way to live life, to do things differently, and hopefully get some other results that have been elusive, whether you work with us or not. That's not I'm not here to sell you anything. I'm here to give you a new perspective, a new lens to look at, and if you want to work with us, cool. If not, I've done my job if you've learned something today. Is that fair? Okay? And so that's always the question, is this like one of those big timeshare things, right? You sit through the thing and then, no. But I will say at the end, I'm going to show you what next steps could look like if that makes sense for you. Is that fair? Just to get that cleared out of the air. Everybody always wonders that one. So here's what we get to see. Shayna, before I was in pain, 2 treatments down, I have some balance. Most of the pain on my right side is gone, on my left leg is improving. These are the stories we get to be a part of. I'm going to share a couple more of those in the presentation, because one thing I've seen is people dealing with neuropathy tend to lose hope, right? And then when you're in those hopeless days, that can be really hard spots. So just to encourage you that there have been people that have been in your seats not that long ago that are on another side of it, living a different experience in their life. Okay? So, who's ready to jump in? Let's talk about what even is peripheral neuropathy. First of all, who knows that they have it, or you're here supporting somebody that you know has neuropathy, who is just curious. I don't know if that's me yet, but I'm wondering if that's what's going on. So most of you know that you have it, or you're supporting somebody that is. Okay, that helps me narrow down what we're going to talk about. Briefly, too, sometimes my voice gets tight. It's been a long day for me in terms of the speaking. So if you need me to repeat something, let me know. Just say, Doc, say that again. I'm not offended by that in the least. I want to make sure you get the information you're here for. Is that good? Mm-hmm. So here's the bottom line. Neuropathy is damage to your nerves. Keep it real simple. The brain and spine is central nervous system. Everything else is considered peripheral. And so if you have, symptoms of numbness, tingling, what have you, anywhere besides brain and spine, it's considered peripheral neuropathy. Right? So it's a big term, but it covers a lot of things. Bottom line is it's damage to those nerves on some level or another. All right? So this workshop is not for somebody looking for another pill or the quick fix. If you're here for that, this is not going to be it. Okay? If you're looking to go into deeper, like what's actually causing this and what can I do to make changes in my life, because I realize Big Pharma is not coming to save me, right? It's going to be up to you to make changes in your world to make this different. Then we're hoping to give you some clarity and answers on what that looks like. Is that fair? Okay. So my goal today is to show you natural ways to heal where you're going to see 50 to 100% improvement from where you are now, even when you've tried other stuff that hasn't worked. Sounds like a pretty big claim, right? Hang in there. We're going to show you a live demo. One of you will get an opportunity to see what actually we're going to show you in real time what we do and see if you can respond. It's kind of like a nerve response test. And someone will have that opportunity a little later this afternoon. Okay. So, what I want you to walk away with is understanding today. That's the main thing. A lot of times, people are going into it. I don't even know what this is. How bad is it? My doctor said I have neuropathy. Maybe they did some EMG studies. They tried various different things, but essentially at the end of the day, they're saying, here's your gabapentin, here's your Lyrica, here's your Cymbalta. You've been there, done that, heard that story. Still doing the story, right? Okay. So really, I want to show you how we can measure this objectively, and then you can know what your best next step is with confidence, okay? So over 20 million people in the US are dealing with this, and this is 10-year-old data. So it's bigger than that now, and we know that guys tend to be tough, and we don't report stuff, right? So these are underreported numbers as well, but it's 1 in 6 people over age 40 dealing with neuropathy. That's a bunch of people, right? How do you get this? Can you catch it? Is it contagious? Thankfully, no. Why is this such a big deal? We'll talk about it here in a moment. So, traditional model and why that tends to fall short. Medications dull pain, but they cannot restore function. There's no medication or pill or injection that can actually restore function in your body. Your body does it on its own, does it naturally. It can't change what you feel, and so usually decline is labeled as normal, and then you have to increase your dosages, and so on and so forth. But the bottom line there is nerves aren't dying from lack of drugs, they're dying from lack of nourishment. Does that make sense? So if we can nourish a nerve, we're going to see improvements typically. Who's tired of symptom management? That's why you're here. That's why you're drumming now. Right? So let's talk about what that looks like. Commonly, these are things I hear in our consultation. Doc, I used to be able to do this. I wish I could do that again. I used to have better balance. I'm scared of falling. These are common, I can't sleep. It wakes me up all the time. These are super common things. And so you start losing your independence. Nobody wants that. And I took this picture a couple years ago. This is my anniversary trip. I went to the Finger Lakes and a lot of stairs over there, right? And I was like, man, my patients on this side would hate to even think about attempting that, let alone, just missing out the beauty that's all there is to see. So I realized that this, it stops you from doing stuff, right? It just starts robbing that from your life. So the goal is, what can we do to make that improve? Here's the big idea. If you have nothing else today, understand this. The only way to reverse neuropathy or improve it is to restore nerve function. And the only way to restore nerve function is if you re-nutrify and actually help the nerve get what it needs. Does that make sense? So again, I got the plant picture. It's a common idea, but it's pretty understandable. What does a plant need to survive? Water. What else? Sunlight. Nutrients, right? These are basic things. We still need them as human beings. We need sunlight. We need light energy to make the body run. It changes our wake and sleep cycle. All the things. So light's important. You'll see why that is in a minute. It's one of the treatments we use. So light is one. Soil, that's where the plant gets its nutrients. We need nutrients for the body to run right too, right? And then water, obviously we need water. But so let's say the plant is wilting, it's dying. What are you going to start to do?
Feed it.
Right? Yeah, feed it food. Maybe you put it in a sunnier spot, right? You might transplant, you might change the soil, you would change the environment the plant lives in. We're very, very similar. If you can change the internal environment in the body, what do you think happens? You get a better shot at making it better, right? The plant might come back. What if that plant is wilted too far and you change the soil, you nutrify it, you do all the things, but it's still too far gone? What happens to the plant? It's been beat up too long. Some people are in that state. Just to be honest with you, if you've lost 85% nerve function, you're going to have permanent nerve damage. We've seen some of that come back, but it never goes to full resolution or super rare. Does that make sense? So I'm not blowing smoke. We can fix everything we can. But that's one of the things to understand is if the nerve has lost 85% function, that's when you have some permanent damage. So that's what we're going to try to measure and go, where are we at? Where are we at on the scale? What's possible, right? So that's the big idea. If we nourish the nerve, we got a shot. So here's the 3 primary drivers. What creates damage in the nerve? These are the themes we see over and over and over again. Poor circulation and oxygen delivery. That can be from a host of different things. Underlying heart issues, circulation problems, blood sugar problems, on and on. Chronic inflammation. That's like a sunburn on the inside of your body. Okay, nerves don't like that. Inflammation is bad. And the other one is breakdown in nerve signaling. That could be anything from like a disc problem in the back, a nerve injury in the spine, head injuries, concussions. Does that make sense? Things like that would disturb the nerve flow in the body. So if you don't address all three of them, you're going to see symptoms persist. Now you can use medication to effectively change what you feel or perceive, but it's not actually treating any of the underlying issues. Does that make sense? Barring a few things. One of the inflammatory ones you'll see in a minute is actually, well, I'll just wait till we get there. I'll tell you about that. So circulation, inflammation, and nerve signaling. Good? All right. So secret number one then is, if we can improve circulation, we're going to start to change the environment. The body can actually get nourishment to the tissue. Okay? So one of the ways we measure that is with a thermal scan. A lot of my patients at doc, they had the Doppler, they did the scan, my arteries were fine. But they're looking at the major highways. They're not looking at the microcirculation called the capillaries. Capillaries are the smallest blood vessel. Your blood cells line up literally one at a time to go through those blood vessels. Okay, and so that's what we're looking at. That's what's feeding the nerve, not your major arteries. So we live in Pennsylvania here. We don't get as much snow as we used to, but when it snows, what happens? Where do they plow first? The main roads, right? The arteries get opened up so the main traffic can flow. Are they shoveling your driveway? No, right? That's up to you to do, right? So that's the same idea. If no one's out there, your car's jammed up in the garage or right, it doesn't open up the pathways to get the local traffic that matters to you out, but they open the big roads first, right? So same idea here. We do a thermal image to look at microcirculation. Okay, so red and white are the normal colors in my office. Anything less than red and white is not acceptable. Kind of that simple. So in this picture on the left, what do you notice in the hands and the torso? Red and white. That's what we want to see. That's good heat. That's good blood flow in the tissue. What are you noticing in the feet? Right, they're cooler colors. Right, yellow and red. Or I'm sorry, yellow and green and blue. They're getting colder in the extremities, especially the feet. Right? So that's 6 weeks later, middle of July. What are you noticing now in the feet? Yeah, it's not perfect, but we're seeing blood flow starting to improve. We're seeing circulation improve in the tissue. We've just started to open up the ability of the body to get blood flow back into the nerve. Does that make sense? So that's one of the things we look at and measure. Number two, and actually let me take a step into this because it's usually a helpful demonstration for people. So everybody put your hand up for me here because this is answering the main question. Why in the world does neuropathy develop? Everybody wants to know, what is neuropathy, how does it get where it gets? So this is your nerve cell. Put your hand up like that for me. That's your nerve cell. And these fingers are going to represent the blood vessels that feed the nerve. Okay? And so what I want you to do is squeeze a fist as tightly as you can, and we're going to hold this for 15 minutes. Okay, let's just say 15 minutes goes by, right? What are you going to notice in your hand if you held it for 15 minutes or longer? What's that going to feel like? Numb. Say it again. You wouldn't be able to open it. Or it gets stiff, right? That's another symptom. Like some people, I get so stiff. Yep. So we wouldn't be able to open it. Numbness. You might get some burning or pain. Kind of sounds like neuropathy symptoms, right? You can rest your hand. The idea is if you're choking the blood supply, if you're suffocating that nerve and starving it of nutrients, it's going to let you out. So the better question is, what causes this? And if we can solve that, we're going to win. Does that make sense? So there's literally, if you check the research, there's over 100 different conditions that cause neuropathy. well, let's have a pill for each one or a procedure for each one, right? That's craziness. Why don't we just go to the cause of it? And if we increase circulation, blood flow, we got a big chance of making this better. So you're tracking with me? So that's a big deal. So that's why we look at oxygenation and nutrition and circulation first. Okay? That way we can get goodies to the nerve and get the junk out. Things work better that way. So number 2 then is inflammation. And the big triggers there are prolonged stress. Does stress do more relaxing or more of this? Right? So you shut off circulation to the extremities, you keep it at the core when your body's under stress. That's a big one. Pathogens, we'll talk a little bit more about this one. There's a specific infection, and we're number 1 in Pennsylvania, really in the world. Pennsylvania is number 1 in the world for this particular infection. What is it? Sinuses are bad. Like, that's not it. But hunters get it a lot. Yeah, a lot of tick-borne illnesses, Lyme disease, right? So one of the co-infections with Lyme or tick-borne illnesses is called babesia. And that one is known to create neuropathy symptoms. So just to be aware of that, that's something we screen for routinely in our assessments to see, is there an immune element that's driving some of the situation. So pathogens can be a big deal. Obviously, like shingles, it's a viral kind of nerve pain, right? So viruses can create this too. And then everything that mama told you not to do, all the junk food, right? Don't eat junk food. Everybody knows that, but it's hard to do, right? So junk food, and then chemicals and medications, commonly, it's a known side effect that chemotherapy will create neuropathy. Okay, and from a clinical standpoint, it's actually one of the easier ones to treat, to be honest with you, in terms of the neuropathy condition. Obviously, what's underlying that is a bigger deal, but in terms of getting some relief, that's actually they respond fairly well. And the other thing with medications would be statin drugs. You need to be aware of that one. So statins are usually used to lower cholesterol, and one of the side effects of some of the statins is actually muscle weaknesses, neuropathies, things like that. So you might check with if you're on those, I would say check with your pharmacist and have them run a comparison of all the meds that you're on to see if there's any cross interactions, things like that. Okay, because they're probably going to tell you quicker than your primary would. Is that fair? So be aware of that. Things like heavy metals, lead, that's bad. Mercury, that's bad, right? So these things are in our environment. Some of that's in our mouth. With the mercury, I won't get into that a whole bit, but sometimes dental issues are creating nerve problems that way as well. And then chronic dehydration. Important, well, take a sip of water. You need half your body weight in ounces a day as a general rule of thumb. Okay, half your body weight in ounces. And if you're drinking coffee, every cup of coffee you have is going to deplete you of 2 cups of water. Okay, so nerves need water. It's kind of a simple answer there.
Is that true even if it's decaf?
So decaf has less caffeine, but it's still caffeinated. And unless it's organic, the junk they put in it to decaffeinate it is pretty poisonous. So I find it right. You might as well just drink the leaded, is my thought. But anyway, I get twitchy on caffeine. I just don't process that well genetically. That's not my jam. So again, caffeine of any flavor. Yeah, so like tea, depending on the tea, may or may not have as much as a cup of coffee. We can split hairs, but the idea is when you have caffeine, does it do more of this or this? Right, we're going to avoid this. So whatever we can do to avoid this is going to help us get better results. Is that fair? Yeah. So we can give specific dietary things, but I'm not here to babysit your lunchbox, right? Is that fair? Good. So here's what we see with inflammation, which is a big deal. Now, when Isabel came in, wonderful French lady, great sense of humor, and very thick French accent, but she wrote in her intake paperwork, she said, "Doc, if something's not different, within a year, I'm going to be dead. Like, I'm on death's door here. This is a big deal." And she had a daughter who she wanted to help move into college and, do all the mom things. So we're like, okay, we got to go to work. So we helped her detoxify, get junk out of her system, the junk out of her lifestyle, reduce inflammation in her diet, helped her with hydration, and we used light therapy. Remember I said that with the plant. You need light, so light helps nerves heal. And she went through that process, and she says, I'm on the top of the world, flying on a cloud no matter what are the circumstances. I'm feeling at my best in my body at 53. A year ago, I was told that I was very sick. So this picture here is kind of a fun one. She came in shortly before that, and she's like, Doc, I'm feeling great. I got my life back. We're going to go take my daughter to college. Everything is doing great. But I'm giving you a bill. And I'm like, okay, what I miss? What's going on? And she said, well, I've lost 70 pounds. None of my clothes fit anymore. My entire wardrobe has to be renewed. And so I'm giving you the bill for my new wardrobe. And so that was her French sense of humor. We had a good laugh about that. So this picture is 70 pounds lighter. She continued, she's lost at least another 20 plus since then. And continues to do really well. So I mention that for two reasons. One, to encourage you, but also two, some of you aren't really ready for the change that's possible in your own body. Like, you still have that belief, like, I don't know if I can really change that much. Some can, some can't. But just to let you know, like, that's possible and it happens, but just to be aware of your own limiting beliefs of what your body's actually capable of doing. To bring some of that awareness. So, enough about Isabel. Big thing I see is a lot of people are treating neuropathy blindfolded. They don't even know where they're at. I'm going to try this thing, try that thing, and they don't really measure anything to know where they're going or where they've been. So that's what we do is so we can measure something so you know where am I starting and where am I going and is it making any changes and are we moving the needle, right? You cannot fix what we don't measure. So typically we see when you address the root of this stuff with nerve flow and with oxygenation and with inflammation, we see better balance, which is a big deal. Reducing pain, your confidence increases just in your general life. I had one gentleman, he was a former race car driver, and he's like, I can't feel the pedals anymore. Like, that's a big deal for somebody that was their life, right? Let alone, everybody else that is silently nodding their head going, yeah, I'm starting to lose the feeling in my pedals too. Like, that's scary for a dad with some young kids on the road going, maybe, now I'm not going to tell you about his license, that's outside my scope. But just to let you know, like, that's a big deal. That's like, not only your own life, but you're risking other people if that's the boat that you're in, right? So just be aware of that. Maybe you should mention that part. I'm not trying to shame you guys. I'm just trying to give some help. So my final thought on this slide would be just that, like, I know neuropathy can improve. The question is, where is yours at and can yours improve? That's the question we need to answer. A couple other stories here. Jay, man, he was miserable. He thought it was just arch problems at his feet, but I mentioned this because Judy says we were miserable. It's not just Jay that was suffering, it was the care team, right? All the support people around you that are trying to help out, and they're dealing with this too on a different level. And then one thing I've seen commonly is like, it creates some friction in relationships. Because let's say the husband's dealing with it, and the wife knows it, but she doesn't want to nag him because she knows he's having a hard day. And he doesn't want to say anything and make her worry more, right? Like, and it just goes, you know what I'm talking about? No, blank stares, really? Yeah, all right, yeah. So anyway, it creates other conflict besides just what you're dealing with. I see this often. Anyway, Jay had to give up his job. He was a painter, couldn't go up ladders anymore. It was just a dangerous situation for him. But now he's doing better, got to walk without pain and get his job back. Rick, man, this guy, amazing man, but he was waking up 5 to 6 times a night. And I don't know about you, but if I have a bad night's sleep, I'm a little cranky the next day. Things aren't running quite as well as they should be upstairs, and the filter's a little lower. Anybody else, right? You're waking up, man. So his main reason for showing up though was he had a son with severe special needs, and he wanted to be the dad that he knew that he could be, and he wanted to show up for his son. Now he's sleeping through the night, and he's not getting up anymore. Neuropathy is 75% better. This is about 90 days in for Rick. Okay. Sandy, yeah, I mean, a lot to say about Sandy too, but saw a lot of progress with her neuropathy. First came in, was in bad shape, couldn't walk, experienced a lot of pain in my legs. Now my right leg is pain-free, my left leg is feeling better, and the treatment's helping. It's worth everything. So again, just some encouraging stories of people that have been where you are. I mentioned Leroy. He got 50% better. He was a diabetic and would not stop drinking Turkey Hill sweet tea. Okay? I'm like, again, I'm going to tell you the best thing to do, but if you're going to, but I mention that because you don't need to be perfect to make progress. He still got 50% improvement, even though he would not give up some of the vices, right? He wasn't 100% compliant. So don't think you need to be perfect to make changes and make headway. And then we get to see other fun things like, I can't feel my toes, or I can feel them now for the first time in 5 to 6 years. You literally go feeling her toes, now she's feeling her toes. Same thing with the gentleman here, 10 years, a decade. So don't think that, oh, I've had this too long, it's hopeless. That's not always the case. So just to encourage you with that. All right. That being said, we can't save every nerve. We can wake up a lot of them. And the earlier, obviously, like a lot of things, the earlier you intervene, the better chance you have of making good headway with better outcomes. And the first step, though, is getting clarity on where am I at? How beat up is the nerve? You know, is it just where we are on that scale? So what I want to show you now is the healing process we go through, and show what it looks like in real time with the nerve signaling. Okay. And if I can, we're doing right on time. I want to share. Has somebody heard the story about my dad? Not yet. So this is what you heard of. Yeah, so I'm going to share that with the rest of the group. This all got me standing like, why do we do these workshops? And why share this information? And for me, I kind of got into it, turning some pain into purpose, right? And so I never went to school and said, hey, I want to be help people with neuropathy. That's not what I would specialize in. But you ever have like the school of hard knocks and you learn some hard things and you make the best out of it that you can? That was kind of my journey. So backing up a little bit, then my dad fought 2 tours in Vietnam and had Agent Orange exposure, right, which is a nerve toxin. Thank you for your service. And so with that, he was also a paratrooper and jumped out of perfectly good airplanes and had back stuff going on. And our family history, we got heart disease and blood sugar issues and things like that. So you pile all that together. And he was a tough guy, right? He's been through some stuff. So he wasn't really telling us how bad things were getting. And he would start losing his balance. But my dad, giant heart, good-hearted man. Our neighbor was having a litter of puppies and wanted to go help out the neighbor. And we had an extra kennel up in the garage. And so we went up the steps to get the kennel. As he's coming down, he lost his balance and he fell. And he ended up breaking his neck. And we thought, he was going to help the neighbor out. He was on the steps for an hour before anybody found him. And that completely changed her life. And my mom called, she's like, hey, your dad fell and we're going to the hospital, but she was in shock. So it didn't translate like how severe the issue was, But that party that just knows, like, I need to go look at this a little deeper. And so I drove down to the hospital in Lancaster and I went in, and I'll never forget when they're like, Doc, we're doing everything we can. We got your dad in traction. I'm like, what? Okay, I thought he just fell, and then I learned all these other details that were kind of important. But we got him in traction. Here's the films, and these are the ones you never want to see your own family member, let alone just anybody with. But he ended up being in a wheelchair for the rest of his days. He was a C5 quad. He could kind of feed himself, but he didn't really hug the kids and the grandkids anymore. Definitely wasn't running around and playing and all that stuff. It was good. So we've been through every piece of this puzzle, financially, he was looking at putting on a master bedroom. This was, 12 to 14 years ago. And back then, for nothing fancy, contractor grade stuff was for about 50 grand, right? And it's probably triple that now. So, looking at that, he decided to stay in a assisted care facility, and then went through the whole COVID nonsense. We went through all of this stuff as a family, and it's completely changed our viewpoint on this stuff. So here's my heart. If we can help you with balance and keep one person from living that existence, it's worth every single moment I've spent away from my own family, figuring this out after hours, working on the tough patients, literally traveling around the country for years, studying with the best of the best, and put together protocols that actually work. Because that's what got me doing this. That's the heart we come at to support you with, okay? So if we ever seem, pushy or whatever, I don't think I'm a pushy guy, but just if we ever see, if I think I can help you, it's because I know we can support you. And we're gonna do everything we possibly can to make it better. Is that fair? So that's kind of what got me into this. So that being said, let's check balance for you guys and see where your balance is at. So I'm going to show you a couple of screenings that we do, and then we'll do them as a group. And that'll kind of help you pick who's going to be our winner for the demo today, okay? So if you feel uncomfortable with any of these, don't feel like you need to participate. But here we go. Here's what they look like. We'll stand with your hands go on the hips for all three of these. Okay? Usually only get through two of them because the first two weed out 80-90% of people. So hands go on the hips. Your feet go as close together as you can get them. And then you're going to stand there with your eyes closed for 10 seconds.
No.
Right? If you go over, don't. If you know you're going to go down, don't try this, Jack. That's okay.
Yeah.
Don't be here.
I will.
Yeah. We haven't had anybody go down in these workshops in years, so I'm not, it's a nice night to the first. All right? So yeah, again, know your limits, but that'd be number one. Okay, if that goes down, I already know there's other fish to fry that's beyond the neuropathy piece. There's other central nervous system things we have to play with. That being said, that's number one, okay? Number two is going to be 1 foot up in the air. Okay, eyes open. Yeah. Okay, and then the third one would be what? What do you think we do after this?
Both of them up in the air.
Exactly. Yeah, both up in the air. Got my joke. It would be eyes closed with one knee. Is that fair? So those are the three screenings we do, just to kind of bring some awareness to where your balance is at. And then from there, we'll select someone for the demo and then show you what this looks like. You guys ready? So have you stand up. Get some blood pumping. All righty. Good. So look at the person to your right and left and say, I got your back. Okay? I'm not letting anybody go down there. Yeah. So, and just be your best. There's no one's watching, but the 5 million people on YouTube. Just joking. We had a few people that wanted to tune in online. So here we go. Hands on the hips. Feet go together. And then I'm going to count us in. 3, 2, 1. Close your eyes. 3, 2, 1, and open them. Okay, we have a couple wobblers. All right, so if you wobbled, sit the next one out. Okay, we'll just go with that. Good. So, okay, the next one then is going to be hands on the hips and stand on your strongest leg. You pick whichever one you want. Okay, stand on your strongest leg and it'll be knee up. Try to get it to 90 if you can. In that neighborhood in 3, 2, 1, and go. All right. And stop. All right. Who passed that one? Couple there. So maybe like 3 of you, 4 of you. Awesome. And then the last one would be with your eyes closed with one leg. For the sake of time, if there was more than 4 of you, like do that one, but you can play with that one on your own. So for now, who thought their balance was better than they thought it was. Cool. We're like, hey, that's actually, you're surprised. Okay. Yeah. At least for the moment, it was a good day. Good. Who was about what you thought it was going to be? Okay. And who was like, oh man, I didn't realize it was that bad. You realize you needed some extra help with the balance. Okay. Great. So the idea is just bring some awareness as to where you are with that one. Let me ask this question. Who, anybody not want to be a demo? So I spent time picking somebody like, yeah, I don't want to do that.
What's it require?
So, what's it require? Great question. What we're going to do is check balance up here so everybody can kind of see we're actually going to measure and time your balance. And we'll look for functionality on that. We're then going to check the muscle strength that you stand on. So we'll look at your stair climbers, right? We'll check hamstrings and quads and calf muscles and see if they're firing appropriately. And then we'll do a nerve response check where we're going to use light therapy, some muscle stim basically, or the two main things is a vibration for your feet. Nothing invasive, nothing hurts. You can sit there for maybe 5 minutes and then we see if your nerves are responding. That's going to be our demo. Okay? And then we go, did we make any changes? This kind of shows you what the core of therapy might be like for home care, right? That'd be an important element. So, great question. Is that helpful? Okay. So, let me ask this question. Who has had neuropathy for longer than, say, for like 3 to 5 years in that neighborhood? Then longer than that. Okay. So, okay, who's got it more than 10 years? Wow, okay. Yeah, so, all right. The long-term ones, were for the sake of the demo, we're just going to like pause on that. All right, raise your hand if you're like in the 3 to 5 year range and you got some balance challenges. Jack, I'm going to skip you because you're falling over when you're just two eyes closed with both feet. So we got John and Rhonda, okay. And you know how we solve these? We do rock, paper, scissors, okay, just for some fun. So you remember that game? Kind of, it's a real simple. We got rock, right, paper, and scissors, and you just pick one of those 3, whichever one you want. You ready, John? Okay. 1, 2, 3, go. Okay, pick one of those 3. Pick one of those 3. Either a rock or a paper or a scissor. Okay, let's try it again.
You want to do.
Yeah, whichever. Just pick one of those. Ready? 1, 2, 3, go. Okay, so you got rock. He's got paper. Paper covers rock. It's one of those silly things. So we got to go with John. John, come up here. All right, give him a round of applause. All right. So, John, we never met before, right?
Never.
Okay. Just make sure that they don't think you're a paid actor or some kind of crazy thing.
No,
Okay. So, give me a little background, like a short version. What are you dealing with? Is balance an issue?
I have a neuropathy around like the ball of my feet.
Okay.
I don't know if it's numb or it's oversensitive.
Okay.
I don't like to wear shoes.
Okay.
I got sandals on
Yep.
because it's really very sensitive there. It's very painful in the winter
Yeah.
when it's cold.
Okay.
I need special sandals all the time.
Yeah.
And, I'm a very active person.
Mhm.
It hasn't stopped me. I just ignore the pain and keep doing what I have to
Gotcha.
do.
Yeah.
But it bothers me that I can't
Yeah.
really feel comfortable in the shower. If I'm in any kind of a swimming pool
Yeah.
where the skin is wet, it becomes even more sensitive.
Got it.
And I can't walk without having some cover.
Okay.
It's limited to that, but it's been about 3 to 5 years.
3 to 5 years in that neighborhood. And so is it basically sleep at all or anything?
No, it doesn't
Yeah.
affect that at all.
That's good. Anybody else relate to what he's going through? Sensitive feet and right? Yeah.
That's a quick question.
Yeah.
Is there any relationship between neuromas and neuropathy?
Great question. Neuromas? Yes. Basically, it's a growth in the area around the nerve, which then can compress the nerve. It is. It would fit in the category of a neuropathy, but it's a different animal, if that makes sense. Does that help or I missed it?
Well, no. I was trying to
So a neuroma,
follow it out.
yeah, a neuroma is a growth around the nerve, which then gives you nerve symptoms, but it's technically not that's usually more of a biomechanical issue that creates it more than it is a blood flow. So it's a different,
The
symptoms can be very similar and treatments can still be similar to support it, So in short, yes, there's a lot of help for them, but it is a fairly narrow slice of what neuropathy could be. Yeah.
I've had my feet examined by a couple
Okay.
of podiatrists,
Yep.
physicians.
Yep.
There's no neuroma there.
Okay, good.
They did electrical conduction tests for my legs. They said there is some damage. They didn't really specify.
They didn't say
They
where.
said minor nerve.
Minor nerve damage. Now, to John's point, when they do the electrical one, they're looking for is there nerve flow from the cord down to the nerve. Right? It basically says, is my motor system working or the muscle system's working? There's no machine on the planet that tells you what you feel. Right? So that's more of a subjective thing. Do you feel this? Do you not feel that? Does cold to you feel the same as cold to him? Right? That's a personal sort of thing. Now there are some norms we can go by, but generally speaking, that's an individualized thing. There's no needle they can put in you and check to see what that feels like. Is that fair? So all that to say, great test. It's important to have done. Let's see what John's doing here with his body. Is that cool? Let me stand here, and you should know nothing's going to hurt. That's what everybody's like. Is something going to hurt? Probably not. I'm just going to check some range of motion in the shoulders, because sometimes we see things that they don't seem like they relate to neuropathy, but we see other things improve in the body when we start. Right? When you nourish the plant, does just one leaf grow? No, the whole plant gets better, right? So when we start to change the environment in the body, we might see other things change, and which gives some other lay of the land for what it might be going through. You notice his left shoulder higher than the right one? It's kind of a little lean that way.
Yeah.
So what I would expect is, what's that?
He's right-handed.
He might be.
If his right shoulder's lower, he probably is.
But good thought, but not always correlates.
Okay.
Yep. So that being said, when he's tilted here, I would expect the lat on the left side that holds the shoulder down. So there might be some inhibition or weakness on this left side. We're just going to check that out. Turn the thumb backwards for me. Pull that over to your side. Hold that a little tight. I'm going to pull out. You're going to keep your arm right where it is. There you go. And so that one actually holds together. All right. Let's try this one here. Pull that in tight. Squeeze in. Yeah. And so the lats are okay. Well, the other thing would be his trap on this side holds the shoulder up. And so this one might be off as well. So you bring your head to the shoulder over on the right. I'm going to bring it to the middle. Don't let me. Don't remove your head. Okay, there it is. That one's a little mushier. Right, can't quite hold that. Go to the left side for me. Yep, hold those together. That one is rock solid. Lean to the right again for me. Like that shoulder up a hair. Hold that together. And there you can see it a little easier. See that one breaks away? You notice that? A little weaker on that right side. So let's check range of motion. Let the shoulder relax for me here, nice and soft. All right. EBU's pretty good. I don't think we're going to see a lot of range of motion improvement. Yeah, so no big deal on that. Sometimes you see the shoulder, a frozen shoulder. I've seen them released just in the demo. But he doesn't have that. So let's check balance. That was our main thing. So we can sway forward or backward or left and right. We're going to check to see how he does with that. So I'll have you lean back into my hand. Okay, that's all right. Neutral for me. And then lean it forward in my hand. Okay, and he doesn't have forward stabilization. You notice that you can rest. I got you. Yeah, so when he leans forward, that's a no-go for his brain, which makes some sense because if his brain thinks he's falling forward, he's going to want to fire the extensors to stay upright. You tracking with me? Lean to your left in my hand here. And so his lateral stabilization, pushing in toward me. I should be able to do that. Let's try it to this side here. Go ahead when you're ready. And the right one's decent. I can kind of lean body weight into that a little bit more, right? Yeah, you doing okay on the feet? Okay. So right side works, back works, front and left. I hope you remember this, okay? You know what I'm saying? To do that. Is that fair? Have you seen that? Are you experiencing that too?
No. You're telling me something new.
Okay. Are you noticing though that you're having a harder time resisting when you lean forward into the left?
Just from you showing it to me.
Yeah. So again, so that you're aware, lean back, and I can put some body weight in that. Right? You're stable there.
Yeah.
Yeah. Okay. Neutral for me, and then when you're ready, lean it forward. Okay. And this one, I can just kind of push it right back. Okay. That should not happen. You notice that? Or
But you have the toes to push forward.
yeah. So just bear with me. That again. If left and right were normal, you can lean into here. And these are all normal questions because his brain He's going, this has been my norm for so long, at least 3 to 5 years. His brain is adapted to his world. And he's trying to make sense out of what's going on with my body. Why isn't it stable, right? It's totally normal. Okay, that one's a little mushy. I can push him. And this side here, lean toward me. And this one, I can lean some body weight back into him. Okay, are you noticing that? Yeah, so we're observing, that's all. All right, good. Now, let's do our balance screen. Who wants to time him? I'd be able to go a second hand on their watch. You got hair past the freckle? Anybody have a second hand on the watch? No?
Phone in it.
You got a phone? Phone timer? It's better when somebody else times it than I do, because I'm not,
I can do stopwatch.
Okay, stopwatch. We're done. You got it?
I'm running.
Okay, awesome. So you say go. When you say go, he's going to close his eyes and we'll just monitor balance. Okay, so 10 seconds we're going for. When you're ready,
Go.
close your eyes. There you go.
Ten seconds.
Awesome. How'd that feel? Pretty good. If 10 is if a 10 out of 10 is I can do that all day long, that's totally fine. And 0 is I'm gonna fall over any moment. Where would you say you're at on that scale?
10.
So that's not a big deal. Okay. And then stand on your strongest when he says go. We'll do hands on the hips, stand on your strongest leg, eyes open.
Ready, set, go.
Okay.
7 seconds.
7. Okay, cool. Thank you. So we got to do something else to measure and monitor what he's doing. Okay. So we can improve balance. Obviously, this one's not going to change. But we get the 1 foot up to shift. That'd be a win. But we see an improvement there. And then if sway, if he can have better pressure forward and to the right. Were those ones that were right? Those were the inhibited ones? The left, thank you. Keep me straight. Thanks, Liz. So yeah, when he goes left and leaning forward, those were less stable for him. So we can see those shift. We know that his nervous system is responding. Are you tracking with me? Okay, and then we're going to check actual muscle firings. I'll get to sit down in the chair for me here. And you don't have any wires implanted, no like pacemakers.
No.
Like okay, cool. We're going to have you bring your knee. And if you need to move to see, feel free to kind of move around. I'm just going to check because we need, for stability and balance, we need to make sure the legs are actually doing their job. So we're going to check to see what's going on with this. Perfect. You ready?
Yeah.
Knees going up to the ceiling. Up into my hand. Push that up. Good. Keep breathing. Okay. Try the other one here. Bring that one up for me here. Okay. And the quads are pretty solid. Pull your heel back in my hand. Yeah, bend that knee back. Yeah. And that one you can see, I'm kind of holding the chair, but he's got it, like that one doesn't hold as well. You know, compared to his quad, that was rock solid. Are you noticing that? Did you experience that? It was a little weaker on that one. Pull the heel back from me here. And that one I can't budge. Go back to the left one. Pull back. Yeah. And so he's got a little weakness on that hamstring. You with me? Everybody seeing that?
Yeah, you stood up on his up like a stronger leg.
Right, isn't that interesting? Yeah, very good observation. So we may see other things lower around the ankle that might give us a clue as to why he chose that. Maybe, maybe not. Let's find out. So put your heel on the floor. Yep, and just bring the toes up for me. I'm going to push down on the left one. Keep that foot up in the air. Okay. And that one kind of collapses. Try the right one. Pushing up. And that one is nice and solid. Are you experiencing the same thing there? Weaker on this side with the.
When you tell me.
Yeah, but are you able to feel the difference right to left? Okay, that's the important part because I want your brain to be able to perceive what's changing in your body more than I do this all the time. Doctor can say whatever, but I want you to experience what's changing if there is a change. Okay, so yeah, good thought. This side tests stronger, but he chose this one to stand on. I don't know. I'm a good answer. Doesn't matter to me. Just noticing what's going on. All right. So again, if we can change the rate of firing or the functionality in how those muscles fire, we would anticipate maybe an improvement in function, right? So when I see that foot dropping and the hamstring weaker, I go, there might be a lower back problem involved with this. maybe, maybe not. But the question of, are you tripping over curbs yet? Anything like that? Good. That's usually what happens if it truly is a drop foot developing. You start dragging the foot or tripping up curbs and steps is where that can go. All right. We have enough information, enough assessment going on so far. Let's do some
I have a question. About 5 years ago, I was having less blood flow, so they put stents in both my groins to increase the blood flow.
Yeah.
But after that, that's where I developed neuropathy.
after that.
After that.
Wow, that's a whole discussion for another time. I wish we could dive into that one, Sharon, but that's I got a couple ideas as to why. But basically, again, when there's injury or traumas, does that do this or this? Right? So sometimes a helpful procedure, right, the body still perceives it as a stressor, and for whatever reason it doesn't resolve, and then you still get this happening in the nervous system. Okay. Yeah. So let's see what's going on with John. I'm going to invite Dr. Jeff up to be help here. Yeah. Perfect. So, Dr. Jeff is, he's got great hands, great heart, amazing mind. Very, very glad to have him on the team. We collaborate together highly, and often we'll co-treat people. It's just a fun way to work when you got somebody good to work with, right? So he's going to be doing and applying some of the technology. I'm going to explain what they are, what's going on here. And we're not going to say a whole lot during this. If you have questions, fire them away. But the goal here is to see, we've done some monitoring on how is this nervous system functioning right now, and can we make changes in it? Okay, that's what we're looking for is his body able to respond? Okay, so, that's not what I want. So, okay, let me explain what's and now a lot of this is in your handouts too. So we're using three main pieces of equipment. One is the digital electrotherapeutic stimulator. That's a big word for basically a fancy TENS unit. Okay, who's heard of TENS unit before? You've seen that? Good. TENS is 1950s technology. It does not work for neuropathy. Okay, it's great for muscle spasms, things like that, but it doesn't actually do anything to rehab the nerve. This one sends a signal from, in this case, from the foot. The other cord is connected to the other foot. And what that does is it sends a signal up the spine and actually rehabs the nerve signaling through the cord into both feet.
And does that do anything for numbness?
Yes, so it does several things. TENS, for example, sends one signal from the unit out. That's all it does. This, every few milliseconds, will actually interpret what the nerve's doing and then send a new signal out to make sure it's balancing and actually firing the right way. So when the nerve is firing better, we see better motor response, we see better balance, and then usually when that's improving, that changes input to the brain, where you actually feel the numbness, tingling, and so on, is where that's all perceived, right?
That thing do.
Yeah. Right, so again, we'll get to the light in a second. First thing is, to answer was Donald's question, the digital electrotherapeutic stimulator is actually rehabbing the nerve. Okay, that's its job. It helps to stimulate and rehab the nerve. Then, to your question, Sharon, is the light on his head. The head actually is where the feeling is perceived. Okay, so when he's standing on one leg and balancing, all his balance centers are up here. So we're energizing the head with light. We also commonly recommend that you do it on your feet if that's where you have a lot of symptoms in the feet. We want to energize the foot to get blood flow there. But when we use light, inflammation, remember our three triggers? What were they? Test time. Inflammation was one.
Stress.
Sure, stress would be a trigger for inflammation. Yeah. Blood flow was the other, right? Blood flow, nerves, inflammation. Say that with me. Blood flow, nerves, inflammation. Okay, those are the three keys. So for the nerve, we're using the stimulator. For the blood flow, we're using an inflammation, we're using the light. Okay? And then for, if there's another nerve, we might need to decompress a disc in the back, for example, with this chair here over here by Paul and Jeff in the corner here. That one actually tractions the lower back to make space in the spine. That sounds maybe scary, but it's really gentle and people love it. And that makes the nerve have room to actually do its job. If there's a pinched disc, for example. Does that make sense? So, blood flow, we use light and other, usually diet, nutrition to improve, and supplementation. There's specific nutrients that actually open up your blood vessels to stimulate nitric oxide, and you get a whole thing. But the idea is improve blood flow, light, improve nerve flow, digital electrotherapeutic stimulator. The other one is the vibration that his feet are on improves blood flow and the balance centers in the brain. Okay, so vibration improves balance and improves blood flow. Do you ever push a hand mower?
Yeah.
Okay, what happens if you push that thing too long? What happens to your hands? They get tingly and right? Because you're pushing blood out of the hand. It's the wrong vibration.
Same with driving.
Yeah. Yeah, and so if you're pushing the blood out, if you get the right vibration in, it pulls it back into the tissue. Okay? So that's what this vibration is doing, and vibration also helps with your balance centers in the brain. Make sense? So that's what we're playing with here. And he's got a couple different lasers going, a couple different lights going, because we're energizing the nerve root through the abdomen to the weak muscles that go down to that leg, where we found the inhibitions in the muscle. Okay? Who's lost? That's always I hate that question, right? Because it's like, if I raise my hand, then everybody knows that I'm not. Does anyone have questions about what we're doing? Maybe there's a better
I
way.
have a question about that.
Yeah.
But about the whole idea of
Yeah.
changing what you eat.
Sure.
How long does your body take to react to those much better nutrients?
That's a great question. Averages, right? Because the if you've had it for a decade, it's going to typically be longer than if you had it for a couple months or a year, right? So generally speaking, though, one of the things we commonly do in the exam is actually test nutrients on the tongue to see if the brain is responding to it right now. So to answer your question, clinically, we'll commonly check these things. If the history is obvious, we just go, okay, use this, we know it works. But oftentimes we're like, well, maybe this would support. We'll actually put on the taste buds and see how the nervous system responds. Does the balance improve? Does muscle strength improve? Do we see range of motion improve? We can see instantaneous changes, like literally right there in the office. Okay, so that's this part of the question. The other part of the question is averages 90 days to 120 days. If you're going to change diet, like if you, let's say, have a type 2 diabetes, you need a minimum of 3 to 6 months to make internal changes in the environment for those things to actually get longer term traction. Is that fair? So yeah, I mean, have I seen it happen in a week? Yep. Have I seen it take, usually if it's longer than 90 days, they're cheating. They're not, just to be honest, it's just how it is. Something's going on, or we're missing something, to be fair.
Quick question.
Yeah.
Did I hear you say at the very beginning of the seminar that sciatica is a contributor?
Yeah, absolutely.
Okay.
Yeah, some people, so to be fair, most people feel it in feet, and it's both feet, and it's a multitude of things that are creating that. Some people have it on one limb, and it's their sciatica going down and creating problem in their leg, or a neuroma, for example, could be an issue. So there's many different reasons why it can develop, but yes, sciatica would be in that umbrella.
Okay.
Yep. Yeah. Other questions?
I have a quick question.
Sure.
I have osteoporosis. My bones are decreased and stuff.
Yeah.
I had to have 2 surgeries on my left knee, 2 surgeries on my hip. Does that, any of that equipment affect the bones or?
Let me ask you, we gotta flip the question around. What are your thoughts? What are we trying to do? What are we doing to the
Trying
environment
to
of the
get the
body?
blood flow going a little
Right.
bit better, but
Yeah. So we can reduce inflammation and increase blood flow. We have a chance of things improving more than not.
he
Yeah.
said he
Are we
worked.
treating osteonecrosis with light? No.
No.
Right? And in this case, we're not treating anything. We're giving his body energy. And his body is doing what it wants to do with that energy. Light energy, vibration energy, are you trying to do it? And electrical energy. We're just giving him energy. We're energizing the nerves. And we're gonna see what happens. How are we doing? Yeah. Cool. Let's see what we got. So different concept, different realm, right? A lot of everything you've experienced so far has either been like physical medicine or it's been chemical medicine. And we're looking at adding energy because the body needs energy to heal. What's in the soil and the light that the plant needs, right? It's energy that the plant needs. And so we're doing the same idea. Okay, and not energy in like a woo-woo way, like literally physics. Electrons, light, this is physics. Okay? Cool. All right. John, what are you noticing, if anything? Curious what your experience is at the moment.
It's all right. Yeah, the same.
Okay. Yeah, so similar to when you sat down.
Yeah.
Okay, cool. We're going to check to see what his function is doing. And remind me, it was the left leg that was weaker, right? It was the ankle up and the hamstring. Okay. I remember that. You see why I take notes. But we got it here. So let's bring your heel on the floor and toes up in the air for me. Keep that up in the air. Resist the leg push down. What are you noticing there? Is that different than when we started? Cool. Just making sure I'm not making it up and he's noticing what's happening there. Pull your heel backwards when you're there.
He's a paid actor.
He's a big actor, right? Yeah. What's happening with that one? So a hamstring is firing and its tib anterior is the tarsal muscle thing, but his ankle muscle is now firing better. Pretty cool. So what? Right? So did it change anything else? But what does this start to tell us? We're going to check these other ones in a minute. What do you notice? What does that mean? I'm just curious from your vantage point. So we got the muscle to fire better again. What are you thinking? What are your thoughts?
How long will it last?
Yeah, how long does that last? I don't know. I really don't know. I mean, it might change when he stands up. I don't know yet.
But is he more cognizant now that you did the second time versus the first time?
Okay, that's a great thought too. Yeah, was it something you were thinking about, like, oh, I'm going to try harder? Was that something it just actually functioned easier? Yeah. Great thought. Yep. What else? What else is going through your minds? Has anybody seen? Oh, wait for that question a minute. Let's have you stand up, John, and we'll get to there in a second. Okay. Are your feet? Do they feel different than like as you notice the floor? It's about the same.
Yeah.
Okay.
Same feet.
Same feet. We didn't change them out. Range of motion was good. We're going to skip that. Let's move this way to the left, just a hair, so you're over in there. And then let's bring your ear and shoulder together. Bring that up a little bit. Don't let me separate those two. What are you noticing there? Yeah, right. That's supposed to happen. That's supposed to be solid. When we checked it first, that right side was inhibited. So now we've actually changed function in his neck. That's kind of fun. Let's check balance and see how we're doing with that. So you want to time them again? So we have our same timer.
Which one?
Hands on the hips. We're just going to go straight to one knee up when he says go.
Ready, set, go. Seconds.
Okay. So cool. He almost doubled. What did he get to?
13
Yeah, 13, whatever. So that's kind of fun. Right? Would that be an improvement? It could improve, right?
Yep.
And how long did we work on it? Maybe, I don't know, how long were we doing that? 5 minutes?
4 minutes.
4 minutes.
Yeah.
Okay. Well, let's see what else changed. Right here, we're going to do that leaning. Remember that one?
It was actually 6.
6 minutes?
Yeah.
Okay. Leaning back in my hand. So we didn't break anything. That's good. That's still working. Okay, go back to the center. And lean toward me. Okay. And that one is actually It's pushing me over now. Okay. So that one was that the one that was weaker, right? Leaning.
Yes.
Let me get it for you so I don't have you drop on this. Pushing my hip. Okay, that one's still a little spongy. Okay. And leaning to the right was good before, but just make sure that didn't. Yeah. So he noticed that we saw this like falling forward thing going on. Humor me 1 second. I think there's another piece we can play with to make that improve. You put your hand on your forehead and let your jaw hang loose for a second. You might have a TMJ thing going on. We're just going to stimulate that. Good. Drop that down for me. Lean in my hand again. Yeah. And so there's something going on with his jaw that's affecting his balance that way. So we got other ways to assess so that we don't, hit the home run on first out that. We have other ways to kind of hunt down where this is coming from. But if we can say we give him some stimulation for about 6 minutes, right? And we saw neurological changes, that tells me his nervous system isn't too far gone. We could probably make changes for this guy. Does that make sense? Mm-hmm. Now, who's seen neurological change that quick before? Right? This is what we get to play with. Can you see why the people up here are going, hey, my life is totally different? Imagine doing that. A typical session at home is about 30 minutes, twice a day. And you do that for, 90 days, 120 days. Can you see why the body has a chance to respond and get better and better and better? Is that making sense?
Yes.
Who's thinking, yeah, right? Cool. Yeah, totally. Great. We welcome the skepticism. I was in the same boat. I have no problem with that at all. That's honest, right? Let's give John a round of applause. John, thank you for playing. Honestly, thanks for being here. That really is a joy to see your nervous system change.
I think door number 3.
Yes, we're yeah, you're welcome to have a seat again. Thank you. Yeah. Any other questions on what we're doing to support or what that would look like? Okay.
You were talking about the home stuff.
Yeah.
What your equipment will come home with us.
Yeah, that's it. So what I've found is a hybrid model works best. What I mean by that is nobody who loves spending time at the doctor's office. Nobody. Like, nobody wants to be here.
Do they have ice cream?
That's not really the doctor's office, then, is it? Anyway, we'll get to that another time. But the bottom line is you have a life to live, right? And what I found is if we only treat in the office, we get results like this. Because it doesn't last, to your point. If we can stimulate that day in and day out, it's like you got your own gym at your own house and you can actually use it instead of having to go to a gym, right? You actually make more headway day in and day out. That's why I said at the beginning, this is not the quick fix. If you want a simple thing, this is not it. You need to be invested in you making changes. And what we didn't do is change diet or nutrition right? We didn't change any of that stuff for him. We just started treating the nerves better and giving him some energy. So now we change the internal environment. We get, nutrients on board for blood flow maybe, or maybe blood sugar. I don't know what else is going on metabolically, but maybe we need to support that. So now we get inflammation down, we got the right nutrition in there, right? Maybe we change up the diet a little better, and we're stimulating the nerves in a healthy way. Now we're off to the races. Now your body actually has the resources it needs to win, getting you out of this energy debt that it's been developing.
Ever found a patient you couldn't help?
Yeah, definitely. I mean, it breaks my heart. So we do the exam, and it's like, hey, you got permanent nerve damage. We gotta have an honest conversation.
You got what?
Permanent nerve damage. Like you're beyond this, like we can do our best to treat. Like I had one lady, she literally couldn't feel her feet at all from like the shin down. Totally numb. Zero. Felt nothing. And she's like, and my feet are burning. Like she had the feeling of they were just constantly on fire. And she's like, Doc, if you don't do something, I've got a cabin in the woods and I've just thought about just ending it. I can't live this way anymore. So we went for it. We treated her every single day. This is before we did the home care stuff. So every single day for 2 weeks, I was like, if we can make it budge in 2 weeks, maybe we'll keep going. But I don't want to string it. Like, we're not here to just waste your time and money. And she came in about 2 days or 10 days into it, crying, sobbing. I'm like, oh no, something's bad. But these were tears of joy. She's like, I felt my feet for the first time and start to get feeling back in their feet.
But there are people who you can't help.
Yes. So that was one where we thought it was gone. What I'm saying, like, but to your point, yeah, there are some people who are like, this should be a slam dunk, right? To be honest. And for whatever reasons, I don't know if they're telling me the truth about compliance or we missed something else, but like they just didn't improve. Yeah, there's a handful of those. They still keep me up at night sometimes. What in the world did we miss? But I would say, here's what I didn't tell you. 90% of the patients that were able to accept their case, we see improvement. And if I don't think we can help you, I'm not going to string you along and say we can't.
Now I saw that he had the electrodes on his feet. So now do you put that for people have it in their hands?
Yes, yeah, good question. If you have it in your hands, well, there's a couple options for that. Yes, we can stimulate your hands. They make some silver lined gloves that you can use it to stimulate the whole hand. There's ways to support that too. Yeah, good question. But yeah, there are people that we can't help. It's not we guarantee you're going to get better. I'm not going to, go out on that one. That's a shaky one. And yeah, live through some stuff. I've seen ones that we can't help.
You don't mind. I see you're a chiropractor. You do any chiropractic also?
Depends. So the thing is with neuropathy, you may or may not need chiropractic care.
Okay.
So like just because you have that and I'm a chiropractor doesn't mean we're going to be adjusting you. Like, that might sound weird coming from a chiropractor, but my goal is to support your body with what it needs and not give it something it doesn't. Yeah. All right, so yeah, this is not about signing up for anything. Okay, my whole goal in this was to give you an idea on what is out there. It's different from medication, surgeries, injections, and the standard care. Did you learn something like that today? Then I have done my job. From the bottom of my heart, thank you for being here. The question is your body able to recover and how far? If you're interested in learning about that, then can I share what next steps would look like for that?
Yeah.
Okay, so we have a 2-day process for that. We have our discovery day and then we have our report day. And basically we're measuring nerve damage, circulation, oxygen delivery. We check your balance and the fall risk with an actual force plate. We're going to measure your fall risk. We get a number that says you're in danger or you're good or basically green, yellow, or red. How bad is your fall risk? We help to identify your primary driver. Is it blood flow? What were the other two? Inflammation and nerve flow. Great. Okay. And then we help you know if recovery is realistic. What to expect on that. Or, no, we can't help you. Like, we have those conversations too. Yeah. So no guessing, no pressure. Just try to get you answers. Normally, what this includes is our one-on-one consult. We do our comprehensive neurological exam. We do our advanced diagnostics. All of that is in day 1, and then we do our report and recovery response testing, similar to what we did for John on day 2, and to make sure that, hey, if we do these things, is this actually going to be changes that we want to see? Does that make sense? So we actually do a bit of a trial before you even would start into any sort of care. Okay. Normally, all of that would be $975 if we itemize it for insurance. We don't take insurance. We don't play in that world. And frankly, I get the question so often. Medicare writes the guidelines for this stuff. They've actually said if the care plan is designed to improve your quality of life, it's not a medically necessary treatment, which is, I'll paraphrase, but that's basically what it says, which is absolutely insane. They'll pay for your walkers and wheelchairs and whatever, amputations, but they don't pay for you to get better. All that to say, we don't deal with people that aren't on our wavelength, okay? So it just doesn't, it's not a good fit. So all that to say, when we do our nerve assessment, we're gonna let you know, are you in permanent, severe, moderate, acute, or in the normal ranges? Where are you at? That gives us ideas on timelines for healing and what to expect with that, okay? Yeah, questions I get commonly. How do I know this is gonna work for me? Well, we gotta do our assessment and find out. Kind of that simple. We've done this, like I said, I've been doing neuropathy specifically for over a decade. If it matters, I wrote a book about it. Like, I've been doing this for a while. And if I think we can help you, like I said, we're going to do everything we can to support you. If I don't think we can, we're going to support you by getting you to somewhere else that would help you and where you need to be. How How long does it take to see improvement? How long does it take to see John improve?
Yeah.
6 minutes, right? To actually feel and noticeable changes. I've seen it in a week or two. It's not uncommon. People were reporting back within a month that they're noticing changes. At the very least, because neuropathy tends to be a degenerative condition, I want it no worse in 90 days. That's always my target number one. Let's make sure it stops getting worse. And if we can make it improve sooner, great. But if we can stop the progression, would that be a win? It's like keep this thing from getting worse would be another goal. So insurance, we kind of covered that part. That being said, we are going to give you codes that you might be able to build your own company, and they may have some coverage, but just to be honest with you, it's very minimal, and it's going to be out of pocket. Full transparency. Okay. So the next question I usually get is, well, what does it cost then, right? Like, what would that be? We are going to have support for you probably starting around $500 to $1,000 would be the starting point. And then it can go up from there. Averages, if you're in the moderate to severe range, usually there's other metabolic things going on. It's not uncommon to see a $10,000 to $15,000 range for that. What does that include? That would have all the support you would need for nutrition, dietary support, the equipment you would need for home care, in-office visits, follow-ups with the doctor, and we're following you for a year. Okay, that's a quick overview, but it's not like here's your stuff, go home. Like, that's not what we do. This is a doctor-guided, supported program, start to finish. Okay. And there's a bunch of different ways to make that affordable. There's different payment options. I'm not here to bore you with all that stuff, but just to let you know, like, if that's a concern, we can have an honest conversation. We've done all kinds of creative ways to make it affordable for people, so don't think that the money has to be the thing, because it's not the thing. Our goal is to help you out, like, honestly. So we can find a way to do that and make that within your means and funds available. We're going to do everything we can. Okay, does that help to just tell you straight out what that looks like? Okay, I'm not hiding anything. When my exam shows I'm not a candidate, we're going to refer you to somebody that's going to be able to support you. I don't think I should have to say that these days, but some people just do weird stuff. So we're going to get you into good hands if that's where we're at. And then what happens in the new patient exam, you saw some of that with John. We'll do similar testing, check your vitals, check all your neurological signs, and see where we're at. Okay. Yeah. So basically, keep managing your symptoms. Or let's see if we can figure out what the real cause is and get you support to energize your body back to the way it wants to work. So if you want to work on that together, here's what next step is. There are some appointment times often around the corner here. See if you get that? Yeah, awesome. On this little desk back here are our first available appointments. If you're like, hey, that's for me, I want to check that out more, feel free to grab one of those appointment times that works for you, hand that to the gals at the desk. They do an amazing job, and they'll get you that spot. So, one thing I skipped. $975 is usually what it would itemize for. For being here tonight and spending time with us, we're doing everything for $150 for both dates. Okay, so that's what, like, the insurance thing is crazy. So we're not doing that. We're going to do all of that for $150 for our assessment and the report, whether you work with us or not. Does that make sense? So I want it to be a no-brainer and really give you guys options and answers for what that could look like. Okay, so that's for you. That's how you do that. Grab a sticky that has the date and time on that works for you. Hand that to the ladies. They'll collect the $150 to hold your spot, get you all the information you need to get going, and we'll see you for that appointment. One other thing I would say is if you learn something valuable, you don't have a big pharma budget, right? If you click that QR code, it takes us to our Yelp review or whatever, Google review, and just give us like 2 kind words. Tells our neighbors, hey, we're doing some good stuff. This is probably the last one of these we're doing for the year. I don't know if we'll do any next year, various reasons, but just to let you know, this is kind of our last shot for the year. That's we're reevaluating.
I don't understand what you just said.
Yeah.
You're asking people for reviews, but you're going to stop.
Stop reviews?
Yeah.
No, the reviews are really helpful
Oh,
in terms of doing another neuropathy workshop.
oh.
Yeah, this is our last one for the year for that. Thanks for asking that clarification. That was
Is it because you're having too many people? You have too many patients?
to a degree, yeah. Like we can only select so many. So like if all of you wanted appointments, it would take us probably the rest of the year to fit that in, right? So yeah, all that to say, we have to be selective with who we're bringing in the program.
There's an expert that he had on the bottom of the street now.
Yep.
You give supplies to do that for a while?
Yeah.
But
Yep.
how often can you use that one expert, the one that's sick that he had was?
Yeah, you use them twice a day, but there's other ways to do it where you don't need the electrode. We can go over all that stuff. It's easy. Yeah. So yeah, I would say please give us a little review. That'd be really helpful, and then grab an appointment. And then if you have the specific one-on-one questions for your case, I'll be here for a couple minutes. I'm happy to talk to you. Otherwise, thanks for being here. From the bottom of my heart, you learned something valuable tonight. Awesome. I've done my job. Thanks for being here. God bless you. We'll see you soon. If you have had a stent, yes, that does not disqualify you just out of the box from getting support. Yeah.
That's why it's
Yeah. I don't know, Jack. Depends what our goals are. Yeah. And so.
Actually, what the surgeon said,
Really? Okay.
there's two more nerves and tendons between your ossification and they said, no, maybe 69. Bleeding, infection,
Yeah.
recovery time. So we're not going to do it. It just too much. That's kind of
Two options go to mind. One is find a different surgeon. That might be, I don't know.
I just moved to Pennsylvania.
Okay, where'd you from?
Way upstate New York.
Okay.
Where it's extremely.
Yeah.
And my surgeon was here. And they said, what kind of help? Well, we got to make stuff.
Yeah.
So I had these people here at Tennessee, I would say, we cut it out, just didn't go for it. Why did they grow in the first place?
Yeah.
Nobody knows why it grows in the first place.
Yeah.
I mean, I'm gonna sign up for the, I want to diagnose with all the problems I have.
Sure.
You know.
Yeah.
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 And working that pain is like fall asleep. It's very painful to wake up. They're driving, I read because I can't tell. I don't want to push them. I'm gonna have to take ground, you know.
Yeah.
I still do some things. Mailbox a half mile away. Go up there a couple times a year, you know. Back in the help everybody.
Yeah.
Okay.
I mean,
I'm
my
just saying,
perspective.
it's a stack deck with me.
Right. Yeah. I'm being honest with we can support what we can and what we don't. I think that's honest about it. The main goal is making sure the muscles are firing around it to give you the most mobility possible.
Pain here. However, we just started an MRI lumbar, all good.
Well, that's great. That's
All good, because they were thinking, oh, it's not.
right.
There it is. So I had the MRI and then I saw the surgery.
Okay. Well then, yeah, maybe that'd be a soft maybe. I don't know yet, buddy.
Okay,
Yeah.
thanks.
Hey, thanks for that.
Numbness with me, walk through the old back.
Okay.
And
First thing in the morning.
cold,
Okay.
but it's actually helping me.
Okay.
No, I.
Yeah.
Thanks.
So now patient that is a factor mostly coming.
I'm trying to figure out what my lady is.
What's it like first thing in the morning when you get out of bed barefoot? What's that like?
Or wear socks.
Interesting.
Didn't wear socks.
Yeah. Okay. Maybe some blood sugar underlying there.
No, I
Yeah. Okay. Yeah. So that's gonna be a factor in there for sure. Yeah. Yeah, let's get it figured out, man. Yeah.
Thanks.
Yeah, certainly. Question?
A little bit.
All right, Jay. What do you got?
Well, I've fallen down about 4 times since the first of the year. And I'm pretty unsteady sometimes when I walk.
Yeah.
So I have to use something to help keep my balance.
Right.
So, and my A1C, the last time it was checked, was about 680.
Okay.
So I questioned a lot of times, because I always come at borderline diabetic anyway.
Yeah.
So I'm wondering if that's not really normal.
I'm gonna push back on the normal term because heart attacks are common but not normal, right? Diabetes is common but not normal, and so if you've got an A1C over 6, you're gonna have nerve damage happening quicker than it can repair. So it's been like that for a while. Sugar's a major player for later.
Yeah, at least the last 10 to 15 years.
I mean, most of that is so reversible. You know, I'm not gonna lie to you. It's like a dietary lifestyle change. I have to change the spin wheels.
The neuropathy, it really came on since I quit working.
Okay.
You know,
Yeah.
when I was working, was active,
Yeah.
going back and forth to work and that kind of thing.
Sure.
It was less.
Mm-hmm.
But since I retired,
Mm-hmm.
my neuropathy has gotten so bad it keeps me awake at night. With the stinging and the burning.
Yeah.
And
You're like,
I know there's
sign
nothing
up
I
for
can,
that.
there's nothing I can do about it right now.
So-
There's nothing I can take or anything.
Right.
So,
Yeah. I wouldn't say like, well, one, if you're serious about making changes to that, let's have a deeper conversation. Are you on? Well, I mean, due to the history, assuming you're not on meds and lower blood sugar, first thing I would do is stop eating all carbohydrates whatsoever. Think of like a paleo or a keto would be a big change in getting that sugar load off the nerves. There might be other things going on.
Yeah.
But if you're almost diabetic, make that change and your nerves have a shot at getting better quicker.
yeah, and sometimes, like, if I have on socks now, they're not actually compression socks,
Yeah.
but they're tight.
Yeah.
All up to here,
Mhm.
that makes it better.
Sure it does. Yeah. Keep that fluid off the nerve. And, yeah. I mean, you're doing supportive things, but if you want to, like, you have to make metabolic changes to get that blood flow back and keep it that way. Yeah. If you're up for that challenge, I mean, I know you've already been through a lot. You can do it. It's just a matter of if you want to do it at this point.
That's the first thing my wife shows.
Yeah.
You gotta have the want to.
Exactly. That's a big key.
Dr. Tomasetti, I'm Kevin.
Hey, Kevin.
I just have a real quick question for you. I think they saw like sucker right across my head because I bought into one of these things.
Okay.
I think it's called a Neuropathy.
Okay.
Okay, and it's a pad.
Yeah.
And it has a little stimulator at the top. You have to keep it charged.
Uh-huh.
Okay, and it has many different settings.
Yeah.
I only use the one setting all the time.
Okay.
I consider that to be nothing more than attention.
Okay.
I could be
Yeah.
totally
I mean,
wrong.
it might be what it is. I'm not sure about the specific item, and there's a million of them out there.
It's a pad that you actually put. They have an outline where you put your feet on.
Yeah. Okay.
Okay.
Yep.
And so I
There's
was
no
just
light on it. It's just like a
no light.
stimulating. Okay.
No light.
Yep.
It's just something that comes through the bottom of
Okay.
the thing into your feet.
Yep.
And I actually feel it when it hits my feet. My calves, you can see my calves pulsate. Okay. Is that something that's even that's
I mean,
helpful?
maybe. I would say possibly theoretically it would make sense because if you're pulsing the calf, you're moving blood flow, right? Like,
Yes, that's
there's some benefit to that.
Okay.
In a general construct, like that would make sense. What frequency are they using? Like, there's a lot of other technical questions around that, but you're not crazy.
Okay.
But not to say a point, like that would be concept is similar to what we're doing with the ETS. Only I know that one works. Like I've just seen it for
Yeah,
for
yeah,
10 years
yeah,
at work.
yeah.
So and we can modulate all kinds of different things with that one to make sure we're getting it
Okay.
confounded. So yeah, you're not crazy. I don't think you're a sucker. It's just
Okay.
probably incomplete. That's the other thing. I have a lot of people come in and go, "Oh, I got this device, I got that device," but they don't have like the whole. They're not getting all three pieces together.
Yes.
They're treating maybe one aspect of it. Like, well, that didn't work. Well, okay, because it was you didn't get the whole. You didn't get the light energy. You didn't get the nutritional changes. You're just trying to stimulate. So again, it's not that it's wrong. It likely is just incomplete.
Okay. Okay.
Yeah, and if you have something like that and we can play with it and see, cool, this would be a piece we can use. I'm not here to give you something else if we don't need it.
Yep. No,
So,
that's
is that helpful?
Yeah, it is very, very, very helpful. And I'm going to sign up for your program. I just have to ask the girls if I can call in for an appointment because I saw the little stickers,
Yeah.
but I can't remember what day is Memorial Day. I want to pick a time we're coming where I meet.
If you call Dave, Kevin, we got you.
Okay. Thank you, sir. I have to be honest and tell you.
Yeah.
Oh, that's all right.
I just have to be honest and tell you, I had that sciatica. I only had it once in my life. And I was talking to other guys that have had sciatica, and they said, "Oh, it's not a once and done thing. You'll get this again in your life."
Yeah.
And it was super, super painful.
Mm-hmm.
So a buddy of mine suggested he's 10 years, 12 years younger than myself, but he's been seeing a chiropractor for years and years and years. He said, "You have to go see a chiropractor." I did go see one. I won't tell you who it was, but I did see one, and I said they did absolutely nothing for me. And I said, I was in his office for less than 4 minutes.
Okay.
And I said to him, "Mike, is that typical?" He says, "No, not really." He says, "When I go to get my adjustments and so forth and so on, they go through a pattern or routine." And he said, "I'm generally in there for 20 to 25 minutes or so." So I have to be very honest with you, being that was my first time experiencing chiropractic services, it kind of turned me off. And I
Makes sense.
I thought to myself, is this the way all chiropractors feel?
Yeah.
But apparently that's not the case.
No. In fact, if I'll be honest, if it's a purely mechanical issue, commonly, I should say, it's purely spinal. That before the adjustment does wonders. And some dogs that's the way they run. They just do that. If he's getting 20 to 25 minutes worth of treatment, they're probably doing soft tissue muscle work as well, and that's probably where the nerve's getting trapped and why it's getting relief.
Yeah.
So if they're not doing muscle work, where the nerve actually travels through, then yours may not be so much spinal as another, that gives me information on what to be looking for.
Okay.
Other one that 90% of people miss is the GI. And the gut is absolutely 100% connected to why this muscle is dysfunction. We'll have that conversation later.
Okay, great.
But yeah,
Great.
the gut's a big one on that one.
Thank you.
Yeah.
Thank you.
My name's
Hey,
Craig.
Craig. Glad you're here, man.
I'm in like the last month of the neuropathy program.
Okay. In Hershey, I'm assuming,
Right.
yeah.
Right.
With Magira or? Okay, good.
And I'm gonna have to continue with 2 minutes travel here.
Wait.
But I like the way your program looks in comparison to theirs.
Yeah, 100%. We use similar tech, but I guarantee you, the level that we dig into this is unsurpassed in the state. And I don't say that braggingly, just the degrees and like, I've been doing it way longer than those guys.
Really?
I've been at the same seminars, some of them at times, and again, I'm not here to brag. I'm just saying, like, we approach this very differently.
How long have you been doing
Over a decade, specifically practice over 20 years. Charles, I'm not sure how long he's been doing it. John Magira, I mean, he's been
it? I've
practicing
been out there
forever.
for about 6 years.
Yeah.
But they advertise that they're down in town for
Yeah, they were down in
some
Delaware.
point.
Mhm.
But the at-home treatment, I only do two things, and I think they help.
Yeah.
I have improved.
Yep.
It's been up and down.
Right.
Sometimes the symptoms are stronger than others, and today's good.
Okay.
Some days I know it's there,
Yeah.
but that tub right there.
Yeah.
I do it with them. I do it in
Yeah.
a slot tub.
Yeah, the blue one.
And,
Yeah.
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 But,
Yeah.
What do you put in? Hot water and what else?
We use electrolytes, either liquid electrolytes or liquid tablet. For electrolytes,
We started with some type of liquid.
Mhm.
I don't remember what it was. Now I just put extra salts in.
yeah, you use salts.
Yeah.
Yeah, you just need something to get some electricity in the tissue.
Do you use any supplements? Like at the beginning of the program, we took plenty of supplements.
Right.
And,
Yeah.
they help too.
Huh?
In hindsight, when the bag ran out, it was over.
I see.
And it worked for me. Whatever one, there was about 4 or 5 different supplements.
Yeah, yeah.
And it worked, and I really don't know what worked.
Okay.
You know what I mean?
Yeah, right.
Which one?
Yeah, and to be honest, Greg, sometimes it's a shock. I think, hey, look, we need to make sure gut's happy. We need to make sure blood flow's happy. Like it's so, yeah, it's like I'm with you. The scientist, he's like, let's make sure we got the one that works, and then in reality, it's like it's the synergy of people that working together that makes the change. Because it's really just like there's the magic bullet. And it's we need gut health, we need information down, we need the blood flow back, we need. Yeah, so I would say I share the question, and I also understand what they're doing to make it comprehensive. Yeah. So I mean, what would keep you from just continuing with that? Just out of curiosity.
Well, first of all, it's constant.
We'll see you soon.
I had people there that couldn't even wire me up.
Oh,
The girls are working.
yeah.
Have you ever been in their place?
I haven't do chocolate.
They have about a room larger than this. It's around the perimeter there with mine. It's probably about 12.
Yeah.
And a couple girls working that one. I just kind of wanted to rush through that. The treatment was only 25 minutes. It was once a week. And I just wasn't satisfied with the level of professionalism.
Yeah. Okay.
The girls didn't want to school.
Yeah.
That's like one every week.
Okay.
And I was getting a little pissed off, to be honest with you.
Yeah.
And also, I only saw Dr. Childs 3 times a year.
Yeah.
That's not light, I think.
Right.
Especially for $7,000. So,
Yeah.
anyway, I'm thinking about what I'm going to do from there, because I think I'm going to need ongoing treatment. Whether it's all at home, that's fine with me. I don't have any problem doing it.
Yeah.
It's like 2.5, 3 hours a day.
Oh, that long.
You soak them, you soak your feet
Yeah.
twice a day for a half hour. That's an hour.
Okay.
And then you put
The boots on.
it's like a sandal on
Yeah.
your foot,
Yeah.
something around your calf.
Yeah.
And you got to do those twice a day. That's 3 hours. You won't do one at a time.
Okay.
You know
So
what I
you're
mean?
more taking time because I ran into the same problem years ago because we used to use the same food.
Yeah.
And yeah, it was like 2.5, 3 hours every day of your life doing this and like, okay, but like you saw Jeff
Is that the home equipment that he demonstrated?
Yeah.
That's nice.
So,
It's like,
that
more
light,
substance.
yeah. One gives you the same amount of energy in about 6 minutes as the food does in a half hour.
Okay.
And it's more important. You treat brain, you treat spine, you treat a knee, and you can do it over the water, so you're saving time.
Really?
Yeah,
See, that's kind of thing that interesting.
Right.
3 hours a day, sometimes
it's a lot. Yeah, usually,
You want it spaced at 8 hours.
right. Our patients typically are doing, maybe twice a day, maybe tops, because with the light and the vibration and the yeah. So you do 10 minutes of vibration, you do the app takes a half hour, that's the longest one. And then another 10 minutes of vibration, lighting, where you can light it up at the same time. And then you're 1 hour instead of, 4
Well, I'm
hours.
gonna wait till this ends. It's gonna be about 1 month yet. And, I probably would have ended up here if you had only put the word neuropathy
On
on
the
it.
side, yeah.
I go by here 4 times a day.
Oh, really? Okay. Yeah.
And I never knew what this was.
Yeah. Unfortunately, our marketing department ought to get on that.
Sure, because I couldn't believe it, but I looked at the address, I was kitchen, trying to buy it every day for 10 years.
Yeah. Well, hey, when that's done, you need some other support. Let me know.
Well,
I'm here to
I'm
help you out.
I will. Cool. All right,
Hey.
nice meeting you.
You too.
Take care.
See ya.
Have a good day.
One screwdriver. I want more of those.
Yeah.
All right. Bye, everybody.